One is that the university has to see this as a priority so that the sort of financial imperative to get as much money as possible out of the royalty stream doesn't get in the way of doing the right thing. And universities tend to be good about that for two reasons. One is we don't make much money on tech transfer. No universities make enormous money. In fact, in the whole United States, less than $2 billion a year change hands in all the royalty agreements in all the hundreds and hundreds of universities. $2 billion. This medical school alone has a budget of $1 billion a year, this one small school. And so that's one reason why I think you will have more and more takers on the effort. The second is that even if you have a crass sort of point of view, the volume that can be used at a lower pay rate for drugs more than medical devices is part of the motivation that allowed the retrovirals to be so broadly distributed in areas of high HIV/AIDS prevalence. So that's one area, is ease off a little bit on the pressure on the tech transfer funding. A second thing that we need to do, a second shoe that has to fall, is that given that the monetary return is not an inhibitor to distribution of drugs, people have to decide what the most important things to distribute. You can't distribute everything. Everything can't go to everybody. And prioritization, as some here, Sonny Kishore and others, and perhaps you have worked on, to have lists of essential meds and so on is important. And it's very important, I think, in making up those lists, once again, to consult with local decision makers and local leaders, and not always to assume that we know what's essential in every culture, because we don't know. We know what's essential in general. We know what's essential here. We think we know, and we may be right most of the time, but I think it's very, very important to have that linkage and prioritization of what those things are. And then thirdly, of course, is in an ideal world, the actual research and development of devices and medications would be affected by needs and not just by markets. And that's tougher. That's tougher because of the unbelievable cost of developing these things and getting them approved. For 8 years, I sat on as a consultant on a medical device panel for the FDA. And that's an interesting experience. If you've never been to an FDA panel meeting, unlike a study section for the NIH, these are open to the public. And it's quite an experience. You go there and you vote on something, and then people run out of the room quick and brokers advise their clients that tomorrow morning's Wall Street Journal is going to say that some panel suggested that a certain drug be voted up or voted down or whatever, and it's time to sell or buy or all those good things. And so having some ability to affect the development pipeline, and that's the toughest one of the three. Some universities have participated in testing of drugs where we don't know what the market is yet by developing good manufacturing practices based local manufacturing facilities. So for example, if a big drug company wants to develop a drug to do something or other and is not sure that it will prove in clinical trials to be safe and efficacious and will eventually get FDA approval, they don't want to set up a production line and spend that money on something that may or may not become financially viable. So they may hire university labs to actually set up the production line for those trials. And at the University of Iowa, where I was for 30 years, because there's a college of pharmacy there, so it was sort of within their academic mission, for 30 years there was a clean room, fancy factory floor kind of manufacturing facility where drugs for clinical trials all over the world were manufactured in that place, taking some pressure off the need to make a certain level of recompense to do it. And so that's the hardest one to do. The two that are more in your control, our control, is to talk with the tech transfer office. I know you're talking with the head of CTech soon, and also to try to affect the choice of essential medicines by consultation with local colleagues.